Welcome to the Long-Term Care Chronicles podcast.
Helen and Elaine, I just want to thank you both for coming on to the Long-Term Care Chronicles this afternoon. And as well, before we start, if I can get you both to just give us a little bit of feedback so the listeners know a little bit about you and the Oasis program.
Okay, well, I'll start. My name's Helen Cooper. I'm a retired person in Kingston. My previous association with the city was that I, at one time, was the mayor of Kingston. And I subsequently worked for the Ontario Public Service for a number of years. And upon retirement, getting to know my own community again a little bit, I was invited to join the board of Oasis volunteer board, which I happily did. And I've been very much involved with it ever since. It couldn't have been better timing for me. Elaine is one of our lovely Oasis members, one of the more active ones.
Yeah, well, I'm 78 years old, of course, retired. Have lived in Bowling Green too for about 3.5 years now. I used to live in this building about 20 years ago with my husband, and we moved away and got our own home. But both of us had always said, when we couldn't look after a house, we were coming back here because this area has everything was closed. Banks, groceries, post office, everything within walking distance. So perfect location. And I think they now have a fancy name for this kind of area called a NORC, which means a natural occurring retirement center. And anyway, my husband died a little over 8.5 years ago. And like they say, don't make any major decisions right away. And I didn't. I liked where I was living and could handle everything. But 3 years after he passed away, I took a heart attack. And that got me thinking about, maybe it's time I looked at something else. And once I was feeling better after that, I had an opportunity to do some volunteer work here at Oasis with their meal program. It didn't last very long because it was just a little too much for me. But it introduced me to the program. And I thought, okay, this is where I want to come for sure. And so I guess it was a couple of years after the heart attack that I had a bad fall putting out garbage one winter evening and slipped on a bit of ice and broke my wrist and didn't do my knees very much good and pulled a muscle in the groin. And I thought, it's time. I can't do this anymore. I've got to be somewhere where I'm safe. And so then I tried to get into this apartment building. Well, that took a little bit of time. And because housing here in Kingston at that time even was at a premium. It was hard to find or to get into good spots. And anyway, I persevered and kept bugging people, especially the superintendent. And he was very helpful, and I eventually got in and so happy to be here. It was the best place I could be in, and I'm so comfortable. And anyway, I'll probably tell you more about all that later.
No problem at all, but thank you both for that. And so we'll start. And and the first question being is, why was the Oasis model created? What was the need that it was filling? And what are the main features of living in a model, which is obviously referred to as what you said, Elaine, a naturally occurring retirement community?
Well, the person to tell you best is Christine McMillan, who founded Oasis. Christine is now in her 90s. She lives in an apartment in Toronto. She moved there to be closer to her family. Money for a pilot project. What they were interested in addressing was the potential of elder abuse and how to deal with it. What they discovered from talking to people who were living in this apartment building is that that was not the issue. The issue was addressing isolation and loneliness. And so Christine and her friends turned this around in terms of what could we be doing that people want. That's the critical importance of Oasis, is that Oasis is serving the needs as stated by the members of Oasis. So we have, give or take, 50 people living in this apartment building. We have a structure where we have a volunteer board of directors, and it's very much the responsibility of the board to be consulting regularly with the members as to what the members' preferences are for programming. We also have enough money to be able to pay a coordinator who can facilitate the programming. And Elaine can tell you many more things that our coordinator does. She's been with the program since the beginning. We are fortunate in that regard. The landlord provides us with communal space, and the landlord doesn't charge us for the use of any of the facilities in the building. And we have a landlord who has informed us on many occasions that they would happily cooperate in expanding the program because there are benefits for the landlord as well. And so I guess I'd better not go on. I better specifically answer your questions.
That's okay. That's okay. Elaine, is there anything you wanted to add to that?
On my part, I really am grateful to Homestead for allowing us to have this wonderful program here. And we're provided with a large common room that we can use. We have an Oasis room as well, a lounge, and also the coordinator. She has her office space in the lounge as well. And we also have storage space to put chairs and tables and things away. So I think a benevolent landlord is a great asset to the whole program. It's a must.
Yeah.
It's really a must.
At the expense of putting words in the landlord's mouth, they will say there are benefits to the landlord as well. That people retain their tenancies longer, and that Oasis members are really good tenants. They pay their rent on time. They never damage the building. They never have wild parties. And so it's a mutually beneficial arrangement. I will say with the expansion of the Oasis program, what's currently being undertaken, Elaine specifically mentioned Homestead Landholdings, who's the original landlord, but there are other landlords becoming involved as well. And the general consensus is that it's a good program for them as well as for the people who enjoy being members.
No, thank you. Yeah, I think I do have a question in regards to the expansion of the program, but I just want to get with the Oasis model that, you do work with a lot of, I guess, the public sector, not-for-profit and private sector organizations, but you have three main pillars, which is mostly preventing social isolation, facilitating better nutrition, and promoting physical fitness. I know you've mentioned about the common areas, but what other types of how these three pillars are being collaborated with at the particular facilities or at the particular homes that everyone resides at?
Well, Oasis, the original isn't a 50-unit apartment building. The expansion project being operated by Queen's University has expanded to 3 other apartment buildings in Kingston, an apartment complex in London, and one in Hamilton, Ontario. And then, as I mentioned previously, the founder of Oasis, Christine McMillan, has started a project in her apartment building in Toronto. It's actually a complex of 2 buildings. So it's very adaptable just to its, and that's part of an important part of the evaluation project with the university, is to determine under what circumstances an Oasis can operate. Elaine has told you about common room space. Some buildings, of course, have much more of it than others. And so we're having to learn what can we do given certain constraints with certain buildings. There's a lot more to go with that. That the essential ingredients are a willing membership. Elaine is one of our active and very helpful members in terms of telling us what she and her fellow members would like to see. We have a volunteer board of directors. It's 7 people. They're all members of the Kingston area community with experience in related activities, part of organizations in the past. We have a source of funds from the provincial government. That is always the critical factor. With that source of funds, we are able to hire a program coordinator, whom Elaine can speak to that as to the role of the coordinator. I call her the glue that keeps the whole thing together. So we offer nutrition before the pandemic through a caterer coming in and serving 3 catered dinners per week, with, as Elaine has pointed out, volunteers to help serve the meals. Very nicely set up dining room for that in the common room. And as Elaine has pointed out, the furniture is stored there when it's not in use. And but we don't manage we as a board of directors don't manage the money directly, nor do we hire the program coordinator. Another essential partner in this whole exercise is Providence Care Hospital, which is a large regional facility, rehabilitative medicine as opposed to acute care. And they offer financial management for us. So the money flows through them. They hire the coordinator. So she has a really good employer with a proper job description, a proper paycheck, and proper benefits. So all these components are critical to making Oasis function. So what I always say, at first of all, it sounds really simple, but it isn't really simple. It in the sense that there needs to be a very well coordinated group of people and institutions that can support it. Once it's up and running, it runs really well. But it's a lot to get it functional in the first.
Definitely for that. Elaine, do you want to add anything else?
Well, you talked about having 3 kind of pillars, and for preventing isolation. It's kind of even hard to talk about this right now because of COVID. We had so much before COVID. All kinds of programs. There was something to do almost every day, plus the meal programs that took away that isolation. You could go down and have a coffee in the lounge in the morning. You know, we had exercise programs twice a week. The VON came in, and our coordinator Tina, did a sitter-size program as well. So there was Wii bowling. There was book clubs. There was movies. We just had so many activities and potluck meals and what do you call them? Community volunteers would come in, let's say from CNIB to tell us about things that could be helpful as far as our sight. We had people from the Hearing Association come over and talk about that. We had people from Providence Care come over and talk about aging and our medications and how to sort that out. And there was it was a multitude of things. There was this program, talk about good nutrition. Even though we were having these meals, they were all, the meals even were very nutritious. No salt in them, watch the sugars, and, everything that was good for us. And the whole program really makes each member feel special. And I think we had a craft group too. That was I happened to start that one. And that was a lot of fun. And we started making dialysis covers for patients down at KGH. We knitted them, and we had about 10 knitters, and we'd sit around and knit these things. And we sent over 700 of these little covers for them, and that gave us a real sense of self-worth. We were still useful. I could go on and on.
No, that's fine. But then what has, during COVID, what has changed for a lot of you?
Well, we're just not allowed to meet together. Like even that craft project, we couldn't continue it because we couldn't keep sending it over to KGH. They, because of the possible contamination maybe from this building, or it never happened, but you didn't know that, so that dried up. And almost all our projects changed.
I think Tina, the coordinator, is still with the program. She's worked very hard to keep in touch with the members any way she can. Those who are familiar with personal computer and the internet, she sent them all kinds of stuff to try to while away the hours. Tina's been bringing some meals in as well, Elaine, I believe, at individual deliveries.
Yeah.
And so, but it's really hard, and it's gone on for so long now. We're just really grateful that nobody in the building has contracted the virus. And Tina was also able to arrange for people to get their vaccinations. I don't, at this point, Elaine, are most of you, have you had your second shot yet or not? I know it was happening soon. They will be very shortly.
Yeah. I think within the next month catches most of us up to our second one.
Yeah.
Okay. And so going into now the private sector accommodation would be with seniors living in the community, and this would be, I guess, free of charge. And again, coming to the same pillars that you had before, where, for physical fitness, hopefully after COVID, and fear of injury and falls, and of course the whole isolation piece, and adequate nutrition. Now, do you think that these buildings, with their sense of community and Oasis providing that support and infrastructure, that this would assist with the current talk of the aging in place model?
I'm a complete convert, but I think it's something that's very interesting is when the research project did go on for over a period of 2 years roughly, and in the buildings I told you before they expanded to. By the way, there was also a mobile home park between Belleville and Trenton, which also had 450 units and a population of many people who'd lived there for many, many years. They do have one central recreation building where Oasis programming was able to take place. What I can tell you is for those expansion buildings, because the research money ran out, we weren't, despite all our attempts to reach for primarily government to try to extend the programs, we weren't successful. But the researchers now have a new 4-year grant. And so they're reopening the programs in Kingston, Belleville, London, Hamilton, Toronto. And all the members in those buildings are ready and willing and able to get going again, which I think is really an interesting comment on the kind of bonds that Oasis has developed, has helped develop amongst the communities that live there. They're ready to get rolling again. So we're hoping with the next 4 years that the program will become increasingly entrenched, and that the wisdom of the program will be seen. I think, as Elaine has stated, it gives people an interest, it gives people a sense of purpose, it gives people just a chance to have a good time and enjoy the company of other people. There's extensive research on this now. I compile a presentation because I'm often asked to present about the program. There's increasing scientific evidence around ability of people to thrive into old age, and meaningful socialization, meaningful relationships with other people are at least as important, if not more important, than anything else. In fact, one researcher, I believe in the University of Utah, has done an extensive study on this, has said being lonely and isolated is as unhealthy for you as smoking 15 cigarettes a day. So it affects anybody. It's younger people who are also potentially very unhealthy. But with older people, it's also means that they neglect taking care of themselves and are physically less able to stop going, be bothered anymore, right? It's too much effort. And that's when people decline. They decline both physically and mentally. And what we are seeing with Oasis is that we have a lot of very lively, happy people. I was one of the volunteers for meal service on Thursdays. And I was doing it with one of the professors on the research project, who's a remarked person in her own right. We were both events, and we got to see folks and chat to them, and it was just a really, really pleasant environment.
that you've mentioned about where the Oasis has now kind of expanded throughout the province. What would then be the requirement if someone wanted to be part of the Oasis program?
Yeah, I think the research project is, well, it's an evaluative project. The point is I can say, I think it's improving people's lives. Elaine can say it too. It's better actually coming from her than I can so happily. But the professors who are undertaking the study are evaluating to be able to say this is uh, even in the period of time that they had to evaluate the programs initially, they were showing results that there are fewer falls, people, that people just generally expressed qualitatively that they were feeling less lonely, that they were enjoying life more. And as I said, we can translate that into people living independently for longer, which is a huge benefit to everybody in our society. I'm not sure I've answered your question. Perhaps you'd like to rephrase.
Well, I guess we'll just go into what, like, I know that you have, there are different research groups with different universities. What has been some of the main points that they've determined? I know you've mentioned a few of them in terms of with the loneliness, but what have been the main markers or key points that they have determined from their documentation of the benefits of an Oasis model?
There are certain quantitative measures. I've already mentioned falls. Incidence of falls is less, and falls very often precipitate extended stays in hospital, transference to long-term care, and so on. It's an oft-told story. So if we can anything prevent people from having serious falls, that's important. And it does look like Oasis is able to achieve that. I think Elaine's pointed it out. I mean, we've had people come in to speak to the members, talk about falls prevention, what they can do for themselves in that regard. But it is also associated with people eating properly and cognitively staying much more alert than would otherwise be the case.
I've really
The research project. Sorry, Elaine.
I was just going to add.
Research project is also looking. Yes.
I was going to add to that because over COVID, I've seen the change in people in the building. It's very visible. People are having more falls again, and the isolation, I'm sure, has got a great part to play in that.
Yes, I'm sure, and yeah, we're very keen to to get past get those second vaccinations and get people so that they're able to get together again.
Yeah.
The other indicators that the scientists are working on are emergency room visits, use of home care, use of other physician services, the sorts of measures you would expect from, and what they were able to show even in the earlier short 2-year study. Population in the new sites with those who've had the Oasis program for a significant period of time, and there is it is statistically significant that by all these measures, Oasis is an improvement. The problem is, of course, that these are all long-term and miracles. But with slow, steady progress, it would appear that we are making an impact on people's lives, and we're doing it in a way that they're enjoying, which is, there's got to be some benefit to that.
Really. And Elaine, is there anything else that you wanted to add?
I'm really on this question. I don't think so. I think Helen's covered it pretty well.
So with the current conversation with long-term care and aging in place, do you feel that the Oasis model can be adapted for the person in long-term care and for Canadians living in the community to be expanded?
Well, yes, it's the principles of Oasis that we've already talked about that are what are needed, and I'm not an expert on long-term care, a long shot, but certainly what's occurred through the pandemic, I am extremely interested. In fact, I am currently reading Andre Picard's book, I Neglected No More.
Yes.
A very well-known health reporter and writer in Canada. And we as a society our country, we are not in the vanguard at all in terms of elder care. Countries like Denmark have far more advanced than we are in terms of having said many years ago they were not going to build any more institutions for long-term care. I'm quite convinced at this stage that building more long-term care is a big, big mistake. That we as a society should be focusing on much more home-like care. Now, Oasis is low touch, if I may put it that way, but and some people will need much more care, particularly as they're entering their 80s or 90s. Well, except that we will say at Oasis, at our site, we have quite a few members who are in their 90s now. So I think we better make that clear. In fact, we have one member who's almost 100. In fact, two members who are almost 100. There may be more. They haven't told me how old they are. But I think people don't want to be pulled out of their home environments into an institution. None of us say we would like that to happen to us. And so I think there are models like Oasis with it could be more intensive care if required, that we can be providing in our communities that are not institutional.
Yeah, I just think that Oasis is kind of takes you up to the dire need of long-term care, and it extends that period of time. That's what I see here. I think there does come a point where some people do need long-term care because of the nursing care required, because we just don't have the people in our system right now to help at the community level. I don't think there are that many PSWs available or the time available for individual care. But I know just from being here that like Helen just said, these people that are in their 90s that are here, they're living independently in their apartments with dignity and still able to take care of themselves, with some community help, but they're doing well. and we benefit from their knowledge and wisdom that they're passing down.
Definitely. And it sounds like there are some key points that can be translated, maybe not in a large scale, but there are some key points that, because you've mentioned about the different programs, people learning and being educated, I think that can too be applied. And just so finally, in terms of any final thoughts in regards with the Oasis program, just the benefits of that, because I know you've mentioned a lot of them, but again, if there's anything that we've missed that you wanted to further detail on.
Well, I'll bow to Elaine.
Oh, I was just thinking this morning, particularly, one of your questions was, what has Oasis seen in regards to senior living in your time of environment? And I think that we're talking about COVID. And I was thinking about what have we done here in Oasis to keep the program growing as well as we did. And I put all how well we've come through this. This last little lockdown just seemed to be almost the straw that broke our back. But our coordinator, she really stepped up and has throughout this pandemic to make sure we had things to do. She's always putting something on the computers, whether it's a podcast on YouTube to watch, could be funny, could be educational, could be about history or the environment, or her education to us about the pandemic and what was happening and when we could expect vaccines, and and on it went. How important it was to wear our masks and what kind. And she spent, I'm sure, more than the hours she's paid to keep us so well informed. We got a good library going where we can go in and pick up a few pocketbooks, and we can do that. We don't have to be in a group just to go in, but every time we're going into that lounge, our temperature's taken, we do our hand washing before we even go up over to pick up a book. And so not only do we have the library, but there's a humongous supply of puzzles, and I know I've done quite a few of them myself. And, just the encouragement we get from our coordinator to get out and walk. Yeah, we don't have exercise programs, but, the weather is nicer now. Maybe not today when it's quite so humid, but other days to get out there, and even if it's just a walk around the building to try and do that. But like Helen said earlier, she's the glue that keeps going. And,
it's Tina. Tina, the coordinator, is the glue. Yes.
Yes.
Yeah, no, we're all reliant on her, and certainly our board. Our board hasn't been able to meet in person for over a year now, but we've met every month by telephone. And Tina joins those calls, so we know Tina is able to report to us what she's done and what members have been able to do. I certainly hope the rate of new cases is going way down in Ontario now. And I would very much hope that, especially outdoors, Elaine, that you would be able to meet outdoors this summer, as long as we are double vaccinated and do everything else that we're instructed to do.
Yeah.
Well, I want to thank you both for coming on to the podcast and to talk about the Oasis program, so more people can know about it and know what it's all about. But I just want to thank you, Helen and Elaine, for coming on and speaking about this. So thank you so much, and I greatly appreciate your time.
Thank you.
Thank you.